All right, listen up. The 28-second blitz. Here's how you decode any ABG fast. Step 1, check the pH. It's your anchor, your first move, always. The range is tight, 7.35 to 7.45. That's the zone. Below 7.35, acidosis. Above 7.45, alkalosis. Simple. No exceptions. Step 2, look at the CO2. Think of it as the respiratory acid. The key word is opposite. Step 3, bicarb. That's your metabolic base. And the keyword here, equal. This gives us our mnemonic, Rome. Respiratory opposite, metabolic, equal. Burn that into your brain. Your target numbers, normal CO2 is 40. Normal bicarb is 24. That's your whole toolkit. Let's go. Dr. Collins, mandatory international medical disclaimer. This content is for educational purposes for international boards only. It is not medical advice. Always consult official guidelines and a specialist physician for clinical decisions. Okay, now let's take a deep dive. Sarah, we hammered on pH first. I call it the boss of interpretation. In a complex gas strip, why is looking at the pH the absolute non-negotiable first step?
Well, because it's the final verdict, isn't it? You could have the CO2 going one way and the bicarb going another. They could both be trying to fix things. But the pH tells you the net result. It tells you what the body's true direction is, whether the primary underlying problem is an acidosis or an alkalosis.
Exactly. And that's the perfect setup for Rome. It's not just a memory trick, it's a diagnostic filter. So walk us through it. Let's say we have an acidosis.
The pH is low. Right. So if the pH is low, you look at the CO2. If the CO2 is high, meaning it's moving in the opposite direction of the pH, that's respiratory opposite. It's a respiratory acidosis, plain and simple. But if that same low pH is paired with a low bicarb, now they're moving on the same side, in the equal direction. That's metabolic equal. You've got a metabolic acidosis. It's a really fast way to sort it out.
It is, but when you're in the heat of the moment, at 3 a.m. in the ICU, sometimes you want a visual. That's where the Tic-Tac-Toe method comes in. It's a game changer for speed. So, Sarah, how do we set up the board? It's super simple. You just draw your 9-square grid, label the columns from left to right, acid, normal, and base. Then you just start placing your values. First, the pH. Is it low, normal, or high? Then CO2, and you have to remember a high CO2 is acidic, so it goes in the acid column. A low CO2 is basic. Bicarb is the opposite. Once you've placed all three, just look for the column that has two values lined up. That's your primary problem.
And that lone value, off in its own column, that's your compensation. It shows you how the body's trying to fight back.
Okay, here's a huge board pearl, a concept that trips a lot of people up. Sometimes you'll get a gas back and the pH looks, normal, say 7.36.
Right. It's technically in the normal range. But you have to ask yourself, which side of 740, which is perfect neutral, is it on? 736 is leaning acidic. That lean is a ghost of the original problem. It's telling you the patient had an acidosis and the body has compensated so well that it's pushed the pH almost all the way back to normal. It's a huge clue.
Absolutely. Now, another pitfall. Let's talk VBG versus ABG. Sarah, what's the one thing, the most critical mistake you can make by looking at a venous gas instead of an arterial one? You cannot, under any circumstances, trust a VBG for oxygenation. Sure, it can give you a rough idea of pH and CO2 sometimes, but for the PaCO2, for knowing if your patient is actually getting enough oxygen, it's completely unreliable. You absolutely must have an arterial sample for that. And that brings us to our question of the day. We want to hear from you. Have you ever seen one of those tricky gas strips where the pH looked normal, but it was hiding a dangerous, fully compensated, or even a triple disturbance? Drop your best ICU catch stories in the comments. We want to hear them. Okay, let's lock this in. Time for the encoding chant. Ready? pH is the boss. 7.35 to 7.45. Rome is the guide.
Respiratory, opposite.
Metabolic, equal side. 40 is the air, CO2. 24 is the care bicarb.
And tic-tac-toe.
Master those core principles and you'll be set. Dr. Collins, and that is your clinical crash course on ABG interpretation. If this helped you, make sure you subscribe to the channel. Next up, we're tackling Module M2.6, Clinical Integration and the Decision Tree. This is pure board exam gold. We'll see you then.